Hello, I'm Dr. Steve Hotze, founder and CEO of Hotze Health and Wellness Center in Houston, Texas. I want to help you obtain and maintain health and wellness naturally so you enjoy a better quality of life. Today I'm going to answer the question that I've been asked many times. Dr. Hotze, why is it that you chose to do natural approaches to health rather than pharmaceutical approaches to health? That's a great question. Before I do that, I want to encourage you to subscribe to the YouTube channel and also to follow me on Facebook at Hotze Health. Okay, here's the question. Dr. Hotze, why in the world do you do natural approaches to health rather than pharmaceutical approaches? It all started back in July 30th of 1976, the day I graduated from medical school. My dad held a party for me at the Houston Club in Houston, Texas. And at the banquet table, he and I sat down on the end, and he turned to me, interestingly enough, and my dad was a wonderfully successful entrepreneur in the manufacturing business. He turned to me and he said, "Son," and I said, "Yes, sir." And he said, "Don't poison your patients like all the other doctors do." And I mulled on that for a minute. And over time, my dad repeated that to me over the next year as I graduated from med school and went into training. So that was in my mind all those years from 1976 until 1988. Now, in the interim, I practiced emergency medicine and I practiced general family medicine and occupational medicine and had an office on the north side of Houston. And one day a little lady came into the office from a retirement center nearby, and she was my first patient of the morning. She sat down with a big smile on her face, which was surprising because very seldom did patients come in with smiles on their face. And I said, "Miss Jones, how are you doing?" And she looked at me with a big smile and said, "Dr. Hotze, ever since I threw away all those drugs you were giving me, I feel like $1 million. And all of a sudden, my dad's saying came back to me, "Don't poison your patients like all the other doctors do." And I thought, this little lady has more sense than me and all my patients and all the doctors I know. She knows that drugs can cause you to be unhealthy, unwell, and sick and cause a host of side effects. And she was done with them. Well, several months later, my dad called me and said, "Son, I want to come over and talk to you. I'm having a little problem." So he came over and he described to me some chest pain that he was having. Well, it sounded to me like it was cardiac in nature. Angina is the proper term of what he was having. And I sent him to see a friend of mine at a local hospital, a cardiologist, who did some evaluation of him and found out that he had an artery that was closed down to his heart. A coronary artery was blocked. And he recommended angioplasty. So the next day my dad went in for angioplasty, and I sat outside in the room and I looked through the glass window at my dad's procedure and I watched the electrocardiogram. And I had a doctor in backup, Dr. Bob Feltman, who's a close friend of mine and a cardiovascular surgeon in case any problem were to develop. Well, sure enough, as I watched the electrocardiogram, it started to have very strange electrical signal on it, which indicated to me that there had been a major catastrophe develop. And I called up Bob. I said, "Bob, get over here. They've blown Dad's artery out." And what they did is they stretched, as they ballooned the angioplasty against the artery wall to try to crush some of the material. It tore open the artery and it caused severe problems to my dad and really killed a tremendous amount of his heart. He ended up having bypass surgery, lived through that. After he got out of the hospital 2 weeks later, Dad asked me in a phone call to my house, said, "Son, I want you to come over here. I want to talk to you." Now, it didn't seem like he was in a very good mood, and I don't blame him. So I went over and he said, "I don't know what the heck I was thinking about letting these doctors invade my body. I have a calcified artery, and they're going to stretch it. It violates every engineering principle I learned." My dad was an engineer who had gone into the manufacturing business, as I mentioned earlier. And he said, "Read this article." So he gives me an article from Dr. Julian Whitaker, a doctor who does natural approaches to health out in California. And Dr. Whitaker written in his article that if you have angioplasty after a heart attack, in the first year you have a 15% chance of dying. If you have bypass surgery, a 5% chance of dying if you don't do anything. but simply lose weight, exercise, take some vitamins and minerals, and eat right, you have a 1% chance of dying. Don't let the doctors invade your body. And that's when my dad said, what do you think about this? And I said, Dad, I wish I'd have read about this. I felt terrible. I'm the oldest of 8 children, 7 boys. And so when Dad asked me that question, I felt really bad about it. I said, Dad, I wish we'd have tried it. And then he said, well, son, this doctor says I need to take vitamins. What do I need to take? I was like a deer in headlight. Well, Dad, I'm a doctor. What do I know about vitamins? And that's a sad commentary. And he looked at me and his eyes pierced me and he said, son, will you find out? I said, yes, sir, I will. I love my daddy. And he said, son, you know what else? I'm firing all my doctors. I'm not going back. You figure out how to get me well and you're going to be my doctor. Well, that was a big responsibility. My dad had congestive heart failure, damaged heart. The doctor had told the family after the procedure that he had a chance of living 1 year. He would be bedridden and never walk again. I went to work studying about vitamins and minerals and hormones and got my dad up on a program. He walked 2 miles every day. My dad was 72 when the procedure took place. He lived 8 years after that, walked 2 miles every day and ran his company that had about 325 employees and did great. The night before he died, I was on the way home from the office. I gave him a call, said, Dad, how are you feeling? And he said, son, I hadn't felt this good since I was 18. Feel like $1 million. Well, the next day, he went to work. And he had told me all his life, since he was 65, he said, I'm going to die right here on the job. I'm never retiring. And he never did. Sure enough, that day, he had an irregular rhythm, pop. He keeled over, dead that day. And you know, I look back and say, gosh, I wish I'd have known what I do now way back when, and maybe Dad would have lived 5 or 10 years longer. But one thing I know is that through my dad's adversity, there was a seed of equal or greater benefit. And what we've established is the Hotze Health and Wellness Center. I've got a Hotze vitamin store that ships vitamins all over the world, and Hotze Compounding Pharmacy. So in my dad's adversity, there was a seed of equal, greater, or greater benefit. That's why in 1989, I started what has now become and is known as the Hotze Health and Wellness Center. That, my friends, was a long time ago. So that's the reason that I chose and have chosen to do natural approaches to health rather than using pharmaceutical and surgical approaches to regaining health. It's better to prevent a problem or correct a problem and prevent it from reoccurring than it is to try to simply mask your symptoms with drugs or have surgical procedures that really don't address the underlying cause of your problem. My goal for you is to help you obtain and maintain health and wellness naturally. I hope you understand now why I've taken this approach. Please be sure to subscribe to my YouTube channel and don't forget to follow me on Facebook at Hotze Health. This is Dr. Hotze saying, look forward to seeing you next week.